Myself is Dr. J Barkataky. I am a consultant neurologist at Hayat Hospital, a super specialty hospital at Guwahati. Today is a very auspicious day. On the 17th November, every year we celebrate as National Epilepsy Day. The idea of celebrating National Epilepsy Day is to increase the awareness about the disease amongst the society, as well as to remove the prejudice from the society. Epilepsy is a chronic disease, and most of the time amongst the common people, it is a big social stigma. That's why increasing awareness and that it is a treatable conditions, this message should be percolated from nooks and corner across the country. So epilepsy, if you see the prevalence of epilepsy, according to World Health Organization's statistics, almost 50 million people across the world are suffering from epilepsy, and 80% of these are living in the developing world. And unfortunately, three-fourths of these patients of epilepsy, they do not come to a neurologist or a physician or to a doctor for seeking medical advice for their problems. So a huge number of patients are having a treatment gap because of the lack of knowledge. And if you consider about India only, around 10 million people in India are suffering from epilepsy. So epilepsy is a chronic disease. It is resulting because of excessive neuronal electrical discharges from the brain, resulting in either twisting movement or tingling sensations in a part of the body with or without loss of consciousness. So epilepsy in the 80% of the situations, it is a treatable conditions, but the patients have to come, the patient have to seek treatment, medical treatment early. If we delay treatment, the complications will increases. So if we get the patients in proper time, in most of the situations, we can control the recurrence of seizure. What I want to speak today about the need to adherence to medications, that anti-epileptic drug, whatever the doctor is prescribing to the patients, the patient need to adhere to it. This is very, very important because a anomalous intake of medications, improper timing of the medications can sometimes cause a catastrophic breakthrough seizure, which has a very long impact in the physical health as well as the occupational health of the patients. So I suggest to give 2 tips to the patients so that they take medications regularly every day. That they should they should set an alarm either in their clock or in their watch or in their mobile so that they take the medications every day in that proper time. And the second thing is that if they still forget, they feel that they still forget, they can set a event in the day-to-day activities, like immediately after taking breakfast or immediately after taking lunch or immediately after taking dinner, they should not miss. Non-adherence, most of the time, it is a very complex situations and it is a multi-layered complications. Most of the time, it is because of the accidental forgetfulness by the patients. But sometimes it is intentional because if the patient do not carry the situation according to their wish, the patient is developing lots of side effects, or in spite of taking medications, the patient is having seizure every now and then. It is not intending to their mental setup. Then in that situations, sometimes they intentionally off taking medications. So the bottom line is that if the patient is taking medications very regularly, whatever is prescribed by his or her doctor, the chance of having seizure is very, very less and is more than 80% of the situations we can control seizure. Thank you.